So good afternoon. Today we're going to be detailing plans for the next phase of our COVID-19 vaccination plan. This will be individuals living and working in congregate care settings. We're also joined by Amy Shackman, who's the President and CEO of Two Life Communities, and Diane Gould, who's the President and CEO of Advocates, to speak more about how their organizations plan to participate in the vaccination program. Just want to give a quick update on the Commonwealth's COVID data. Yesterday, the Department of Public Health reported 4,906 new cases. 69,982 new molecular tests were reported. There are 2,219 patients in the hospital being treated for COVID, and 451 of those are in the ICU. Last month, as most people know, we began vaccinating the first healthcare workers here in the Commonwealth. Since then, over 156,000 doses have been administered to healthcare workers, including in some cases first and second doses. Next, we began long-term care vaccination programming for elderly residents and staff, which is administered by CVS and Walgreens. By the end of this week, all skilled nursing facilities in Massachusetts will have had their first vaccination clinic with either CVS or Walgreens. On Monday, we started vaccinating first responders here in the Commonwealth. We stood up 119 vaccination clinics in partnership with local health departments and have seen terrific response to this in the first few days. We also announced the first mass vaccination site, which will be at Gillette Stadium, which will scale up to administer at least 5,000 vaccines a day. In total, 177,125 doses have been shipped to Massachusetts, including 347,450 doses shipped to providers and 129,675 doses provided to pharmacies as part of that federal pharmacy partnership program. The Command Center and the Department of Public Health are working closely with providers and stakeholders every step along the way to develop plans on how to safely and efficiently distribute vaccines to those who need them most. Distributing vaccines to our residents can't happen fast enough, and we've made enough progress with our frontline healthcare workers and long-term care residents that we're ready to start inoculating the next group of residents. And today we're announcing the details for residents and staff in congregate care facilities, including residential facilities, shelter programs, and corrections. These facilities are prioritized because they serve vulnerable populations in densely populated settings, which means they're at significant risk for contracting COVID-19. The staff are also high risk for exposure at these facilities, and many of them do amazing work, and it's important that they're vaccinated to protect themselves and their families. This includes over 94,000 eligible individuals across Massachusetts. And these vaccinations will begin on Monday, January 18th. As a programming note, a handful of programs in this group have already done their paperwork with the federal government and started administering first doses through the federal pharmacy partnership program with CVS and Walgreens. For all other congregate care sites, which is about 3,500 locations plus corrections, we've been working with providers to set up different vaccination options. Congregate care sites include residential congregate care programs, group homes, residential treatment programs, community-based acute residential treatment programs, and clinical stabilization programs. Shelter programs, including homeless shelters, domestic violence shelters, and veterans shelters, and approved private special education schools. For these programs, they have three options with respect to vaccinations. First, organizations can self-administer vaccines if they meet the guidelines that we posted back in December, including demonstrating that they plan to vaccinate at least 200 individuals. Second, programs can leverage existing pharmacy or provider partnerships that they already have to vaccinate their staff and residents for flu each year. This is a good option for programs that already have existing relationships with local hospitals, healthcare practices, community health centers, university health centers, or visiting nurse programs. Or number three, sort of like Donna White, is that who's the one that does the, you got that? Door number three, mass vaccination sites can also be utilized, and the first one obviously will launch at Gillette Stadium on Monday, and we expect to announce additional details for other sites soon. For more details on this, you can please visit mass.gov/congregate-care-vaccine. Correctional facilities will follow a different process, and Secretary Sutters will talk about that in more detail. Vaccines for these facilities will also begin next week. There are about 6,500 inmates and 4,500 staff at DOC facilities, and we expect inoculations there will take about 3 weeks. For houses of correction that are run by the sheriffs, there'll be a similar process with their medical providers administering vaccines there. Before I close, I do want to mention that later today we're going to refile the legislation that we filed toward the end of the last session to ensure solvency for our unemployment system and to provide relief for the Commonwealth's employers. As we said when we initially filed the bill last month, the sheer volume of unemployment claimants due to COVID-19 automatically triggered an increase in unemployment insurance rates for employers. That's why we want to freeze UI contribution rates for employers, which will provide immediately relief for local businesses across Massachusetts. Though we've already entered a new year, this bill would allow us to charge employers the lower rate retroactively. Secondly, we want to enable the Commonwealth to issue special obligation bonds to repay the federal funds that we received this last year to keep the UI trust fund solvent. This will save money both for the Commonwealth and for employers to ensure that we can continue to pay unemployment benefits to those who need them. And while we wish this legislation could have been passed before the end of the last legislative session, we're committed to providing this important relief for employers early this year and to ensuring the solvency of the UI Trust Fund. To ensure that we provide timely relief to employers, we're going to continue to urge the legislature to act on this bill by early March, which is when rate notices will be issued, and we look forward to working with our legislative partners to get this done before that. Let me just close by saying that I think everybody knows that establishing a vaccination program of this scale, which has never been done before in the U.S., is obviously a complicated exercise. And as we move through the priority groups, our administration will continue to work with stakeholders to provide detailed information on where and when they can get vaccinated. We've made a lot of progress so far. We've administered over 239,000 doses and scaled up to over 100 vaccination sites. The groups that are at the most risk of contracting COVID, healthcare workers, long-term care staff and residents, and first responders, are being vaccinated. Many of them already have. Our administration is working around the clock to ramp up this distribution process and to make sure we have the infrastructure in place to administer these vaccines as they come to us. Vaccines are obviously a critical part of getting back to normal, but we still have to hold on a little while longer and do the things that we know work. I know I sound like a broken record on this stuff, but it's critically important, especially with the new variant here in the U.S. that's far more contagious than the very contagious original COVID-19, that people wear face coverings when they're not in their homes, that they don't hang out with a lot of people they don't live with, that they keep their gatherings small and short. If you're going to be gathering at all, it's best to do it outside rather than inside, and try not to spend a lot of time outside your house. The people of Massachusetts, as we all know, have made tremendous sacrifices throughout this fight against COVID. And while I think we can all agree that brighter days are ahead of us, we still have a long way to go, and everybody's got a role to play in continuing this fight. And I'm sure people of the Commonwealth will be up for it.